Postpartum hemorrhage management right now. First up, try some bimanual massage. You're going to put the side of your hands on this patient's abdomen, one right above the pubis, that's the rigid bone in the center of the pelvis, the other right above that fundus. You are going to kind of roll it around in there like a dough. This is really going to hurt. You need to set that expectation. You can try some oxytocin. Standard dose is about 10 units, but follow your own protocols. What if I don't have any oxytocin? That's okay. You can try to stimulate natural oxytocin. If the baby's alive and well, encourage it to feed. Also, keep mom nice and warm. You need to do that for a bunch of reasons. To encourage the clotting factors to work too. Tranexamic acid, 1 gram of that. That will also quite possibly help in this situation. Ideally, it goes in IV. TXA saves lives if you give it within 3 hours. If the bleed started more than 3 hours ago, move on. It's not indicated. If you cannot get the line, IM TXA is fine. It works fine. You can also give TXA IO. It's just not as studied. Make sure you follow your guidelines on this. I invite you to consider, can you make this worse? No, you can't. This person's bleeding to death and you're not close enough to a facility to get help. Hail Mary bleeding management. Use a junctional tourniquet. So the uterine artery connects at the level of the hips. Why does that matter? If only you could cut off the blood flow to the entire bottom half of this poor woman's body. You can. Junctional tourniquet. Right here, a rigid object compresses the inferior vena cava and descending aorta against the spine, occludes it all the way shut. If you have a commercial device, you should use that. This is exactly the moment to use that. Do that. If you don't, that's okay. Improvise. We like the Vindicator nozzle for the rigid object. It goes right across the level of the patient's belly button. Axe handle's fine too. So is an Nalgene bottle. So is an oxygen tank. I don't care. 140 pounds of pressure on that. You need to weigh at least 250 pounds. So if you weigh a lot less than that, it's you and your partner are both kneeling on this thing to pin it down hard enough. Choose the right provider for this job. And the only limit in improvising the junctional tourniquets is your imagination. There is one more option. This one's legally complicated, but I don't think there's such a thing as bad knowledge. Bimanual compression. You hook one hand over that pubis, the other hand you put up the patient's vagina into a fist, and you manually compress this uterus so she can't bleed out from that. Will you lose your job for doing this? Quite possibly. I truly don't know. Finally, if all of these steps have failed and this person is continuing to bleed to death, you need to call medical control. You have truly exhausted all your pre-hospital options. Thank you for listening, and remember to follow your own protocols and that I am not your medical director.